Many people view talking about stools as forbidden or, at the absolute least, offensive. People tend to avoid discussing it and frequently overlook concerning changes that could be signs of more significant health problems. Today, we want to shed some light on the need of seeing a doctor and how a simple examination of your stool can reveal problems with your intestines. When it comes to stools, what is normal? What are the things you should focus on when you should visit the doctor? What is a normal stool? Although everyone has a different idea of what's normal, medical professionals have long defined what a healthy stool looks like and what doesn't mean there is a problem. The typical frequency of bowel motions is 3 times per day to 3 times per week. A person does not experience diarrhea or constipation throughout this. Their feces are dark in color, have a mushy consistency, and resemble sausages. A third of the stool in question is made of undigested dietary fiber. A third is dead intestinal bacteria, and the remaining third is made up of metabolic products. Regretfully, not everyone has a stomach this healthy. When does the condition of your stool signal an illness? In France, they really think that it's important to talk about everything related to health, even the things we frequently feel ashamed of. Many people will be made aware of this important topic by watching this video. And if you subscribe to the channel and tell your friends about it, even more people will be made aware of the importance of taking care of their health instead of waiting for problems to arise. What is the color of your stool? The color of your stool should be your initial consideration. As previously said, it should be brown, signifying that bacteria are active and dead red blood cells are freely moving from the liver to the intestines. Gilbert-Mollering-Rook syndrome is characterized by a shift in stool color from light brown to yellow, indicating that the enzyme that breaks down red blood cells isn't functioning at its best. Thankfully, this alteration is benign, with acetaminophen intolerance being the only apparent side effect. The incidence of Gilbert-Mollering-Rook syndrome is about 8%. A bright yellow stool is a sign that bacteria are not able to effectively break down food. This can be brought on by using antibiotics and is frequently accompanied with diarrhea. A change in stool color is one of the indications of pancreatic dysfunction, which might lead to more severe circumstances. What does the consistency tell us about? Stool density and form are 2 other crucial markers of intestinal health. Stool consistency is even measured using a full scale in medicine. Solid stool is described by the first and second scale kinds, which range in size from tiny pellets to big clumps. This kind of stool happens during constipation in both situations. The third and fourth varieties have a sausage-like shape and can be grooved and cracked or smooth. This consistency of the feces is seen as perfectly typical. On the other hand, diarrhea results in the 6 and 7 types of feces, which are loose blobs to watery discharges devoid of solid particles. Of course, if constipation or diarrhea are clearly present, it's crucial to determine the cause, particularly if the problem lasts for a long time. Furthermore, it's important to be aware of any gas in the stool. A clear sign of this is when the stool stays above the ground. Note any modification to its odor as well. This instrument represents the functions occurring with the intestines and, in conjunction with further indications, may be indicative of grave medical issues. Normalizing stool can occasionally be attained by making dietary changes, cutting out sugars, fast food, chemical additives, and fatty and fried foods can all help with gas problems and lessen with the strain on the pancreas and liver. But if you follow the recommended course of action and the stool still doesn't match the normal range, you should consider having a gastrointestinal exam. The tests and functional diagnostic procedures that are required will be prescribed by a physician and will objectively demonstrate the state of the intestines and the microbiome that is in charge of food digestion. If you liked the video, give it a thumbs up and share it with your friends. Let us know in the comments down below, what do you think of your stool? You might also want to check out the other videos in our YouTube channel. Just click or tap the videos below here. Thank you for watching.